Hello world. I just thought I'd make a quick video on a procedure that I've been kind of researching on YouTube, and I really haven't seen a lot of like positive stuff. In terms of, I see a lot of really like stupid videos on it that are really, I think, more of like people with an agenda that are trying to scare people away from a potential very life-changing short-term, I guess, not really a long-term. It could be long-term, I guess, but a short-term life-changing operation, and that would be what is called an epidural steroid injection. This video, I just kind of want to explain what happens when you go in for the procedure. Obviously, depending on the pain clinic. I mean, I'm from Fargo, North Dakota. I went to Sanford Orthopedics and Sports Medicine pain clinic on 25th Street in Fargo. That's where I went to get mine. So obviously, if you're in LA or if you're in Houston or something like that, it's gonna be different. But yeah, so I am 22 years old, and I've had two of these epidural steroid injections, the second being today. That's why I've kind of had a little bit of a motivation to maybe record a video and talk about it a little bit. So yeah, in the past maybe probably coming in on 3 months actually, I've had a L5S1 herniated disc, kind of left leg symptoms with that, a lot of sciatica pain. So yeah, that's just a little background about me. Pretty young guy. Don't really want to have young people my age doing this procedure, but hey, it's the doctor that I had, he was so nice, so encouraged me to ask questions, really laid out all the risks, which there are risks, but he said, hey, I don't anticipate having anything. You're young, hopefully this is going to help you out. So yeah, what happens during this procedure, so we don't kind of ramble on about myself, I can make another video for that, is it's an outpatient procedure. You go in, I went in pretty close to my actual operation time, and I was called back immediately, went back, nurse kind of gets your vitals, typical stuff, and then within 2 or 3 minutes this time, the doctor was in, hey, we're bringing you back. So you literally have the clothes. I mean, obviously this is how this clinic does it. I mean, if you're in Orlando and it does it different, or if you're even in Minneapolis, if you're close to me, they could do it different. They could put you on a robe and they could monitor you after, whatever. So you walk into the operating room, and you set your coat down. Now I live in Fargo, it's 30 degrees out, got a big coat with. Then they have you kind of typical doctor stuff, your last name, your first name, date of birth, stuff like that, just so they know they're operating on the right person. Asking you left or right side of your back. In my case, it was the left side. And this time actually, the doctor comes in, oh yeah, right side hernia disc, or a left side lumbar injection, or right side lumbar injection, because you had it wrong. And I'm like, no, I think it's left side. And so they checked the paper, yeah, it's left side. So they lay you flat on like a little table bed. They put a pillow over your like hip area just to like give that a little elevation, I think. For some people, they probably need that pillow, or they might even put two just because they can't get in that position and be comfortable. Myself, I get a little pain in my leg when I lay flat on my belly, just because it's pressing on that nerve. But yeah, they kind of lay you there, and I waited maybe 2-3 minutes, talked to the nurse about like NCAA basketball, just because the doctor wasn't in there yet. And he walks in, he's like, all right, there's a nurse watching the fluoroscopy machine, kind of moving that and changing it, because nowadays, because it's 2019, they have fluoroscopy, and they're able to kind of have a live image of your back. And so they're going to be able to put that needle in the right spot. So yeah, and obviously this is an epidural steroid injection, so they're using a needle and they're jabbing it down right into the area of where your symptoms are originating. So in my case, it's right around that L5S1 nerve root. So the doctor kind of gets his needle ready, gets all his stuff. I mean, it's a very quick procedure. You're in and out in 10 minutes. And so he's like, all right, they rub a bunch of soap on your back just so they like kind of minimize the risk of infection that way. You're not supposed to bathe after it for a couple days just because you could get an infection in your spinal cord, and that would not be good. But you can take showers and everything, and you can take the Band-Aid off. It's fine. Just don't bathe in dirty water. Don't jump in a slough. But yeah, so the doctor gets all his stuff on the table. He's like, all right, we're gonna begin. So he grabs a needle and he kind of. I mean, I'm on my stomach like this. I can't really see what he's doing, but this is just what I feel. So all right, I'm gonna little pinch here, a little burning. So right when he sticks the needle in, they must have a little bit of like medicine that comes out at the end right away as he's going in, as kind of like a little numbing fluid, because it kind of feels like a really mild bee sting. It's kind of like some burning, itching as the needle goes in. It doesn't really feel like a shot. Like I've had a lot of like vaccines and like when they draw blood and things like that. That's just a little pinch for like a second. This is maybe 4 or 5 seconds of like kind of like a burning, itching type feeling right when they stick the needle in. And then they kind of maneuver the fluoroscopy, and the first time I had one, he stuck it in. It was perfect. He didn't move it at all. This time he was kind of, I could feel him moving it around a little bit. And then after a few movements, he's like, all right, this is beautiful. And I was thinking, all right. But yeah, so they kind of get that needle right where they want it, and then all right, here comes the medicine. I mean, there's no wait. And when the medicine goes in my particular case, I feel like I have a pretty high pain tolerance. I mean, I'm a 22-year-old male, but then again, I'm positive there's tougher guys than me. I'm positive there's guys that are bigger pussies than me too. But when they stick the medicine and the medicine starts oozing out in that spot, you feel a lot of pressure. In my case, my whole left leg, felt a lot of tingling. You really feel just nerve pain. I get a lot of just tingling in my whole leg when I've kind of exercised that nerve, because you're getting that blood flowing and just moving it around a little bit. You get a lot of like tingling nerve pain. And then as that tingling nerve pain kind of increases, you start to feel a little bit of like achy pain. I would on my pain scale, which is obviously a personal thing to me, I rate it at maybe a 5 for maybe 10 seconds. You have that pain for. So it's really not that bad at all. There's plenty worse things you could have. It's a very different type of pain than if you like roll your ankle or sprain your knee or get punched by somebody or anything like that. It's hard to describe the type of pain it is, but I'd rate it a 5. That's obviously based on me. I could be a way bigger pussy than you. You could say it's a 1. And then again, I think it depends on how much inflammation you have down there in the first place too. This is my second one, so I've had, obviously a lot of my inflammation's been decreased since the first one, but I still had some embers in there. So that's what we're trying to like extinguish with this second shot. But yeah, man, it's really my experience with it has been awesome. Granted, this is my first day. Hopefully, I don't have any like allergic reactions tonight and don't wake up or something like that. That would be unfortunate. I guess I wouldn't know the difference unless I just kind of woke up and felt like crap and died or something. That's not going to happen though. I feel really great. I've even started to feel, because I think they inject a little bit of like really temporary like anti-inflammatory medicine type stuff. So the day after, you really feel pretty good. And then in like day 2 and 3, you kind of decrease a little bit because that first little patch of medicine wears off. Then you got to wait some days for the real steroid to kick in. But yeah, if you guys have any type of questions about this procedure, be sure to leave them in the comments. I'm happy to answer them. I feel like I'm pretty experienced. I mean, you don't have to go through this many times to know what the scoop is. You really don't. One time, and you're going to be able to answer people's questions on it. So yeah, comments down below. Send me a message. Really, if you guys are having any really second thoughts, you've been watching some just horror stories online. I've watched videos on here where some guy like 3 months after his injection, he just like keeled over and died. And then that's what that family is attributing it to, is that injection, which, I mean, hey, if that happens, you're in the very low 1% of people that get these, and that happens too. Which, would you rather have, I guess the way I'm looking at it is, would I rather work at physical therapy for 8 months and maybe hopefully get better, or would I rather do a procedure like this to enhance my ability to work out and get better physically with physical therapy so I can get better in 2 months or a month? I'm 22. I like to be active. This is what I need to get back to being healthy. I don't. If I was 80 years old, it's a little different. Or if I'm 50, 60, it's a little different because you're maybe not quite as active and want to be as active as a guy like myself. So yeah, this is a life-changing temporary solution to back pain. I highly recommend it to anybody and everybody that has back pain, and they are having, if their doctor's recommending it and you're second guessing it, go for it. It's a great thing. I'm looking forward to maybe a week after this, so then my injection really starts to kick in. Hopefully I'm able to walk really good and go do a lot of physical therapy, and I can get better, because I'm just like anyone else. Back pain is crippling me, and it's tough, but you just got to push through it. Keep your mind right and push through. So yeah, comments down below, send me a message, hit the like button if you enjoyed my little rant. I guess it's not a rant, just the explanation of this procedure. Thanks. Bye.